So today we do have training material available for our Q&A session. If you have not already downloaded that, that is available on our training center. I've asked Ashley to put a link into the chat so that you have that. It's not required for attending today, but it is available to you if you would like it. When you go to the training center, you're going to our live events page. That link Ashley gave you will take you there. You'll look for the title of today's event and you will see a link for training material. The training material is the presentation of the slide deck that I'll be sharing with you today. One thing I do want to point out, this is a Q&A session. I do have some of the questions in the slide deck because we did receive those prior to needing to publish the training materials. Some of the questions are not in the slide deck, but this session is going to be recorded, as I stated, so you will have access to those questions after the session. Now, questions are going to be taken through chat today. We are going through the pre-submitted questions first, and if time allows, we will take live questions if we have those as well. Please feel free to put your questions into chat as you have them. We will answer as many as we have time for today. However, you all sent a lot of great pre-submitted questions, and I want to thank you for that. So if we do not have time to get to every single question that we have for today, I will be sending out a follow-up document to you that will have the questions and answers for today's session. So we'll make sure that you do have those. Also, we do want to hear from you. So I want to make you aware of your opportunity to provide us with some feedback on today's session and your ideas for future education. Your feedback drives our education, helps us improve our education, and helps us make sure that we're offering education that is relevant to you and that is meeting your needs to help you navigate the program more smoothly. So throughout the session, you will get access to that through a link, and you'll have an opportunity at the end to provide us with some feedback. And we really do look at all of that. We want to hear the good, the bad, what could we do better? What did you like about the session? We want to give you the best possible experience. And this is also your opportunity to provide us feedback with topics that you'd like to see in the future. So I'd really appreciate it and encourage you to take a moment to complete that survey when that's available to you today. And last piece of housekeeping, this is our disclaimer that we do need to provide at the beginning of all of our sessions. Material presented today is current and accurate as of today. If you spent any amount of time working with Medicare, you are aware that Medicare rules and regulations do change, and they change often. So please make sure that you continue to monitor all official CMS communications, and that includes the CMS website and the WPS website, to make sure that you are following all current rules and regulations. And finally, CMS does prohibit the screenshotting or recording of this material for profit-making purposes. And as I stated before, we are recording this session today, so you will have that available to you on our website and our YouTube channel. Should you want to see that again, if there's any questions you want to see again, or if there's somebody that you know couldn't attend today that may benefit from this, you can share that with them as well. So that brings me to our objectives and our agenda for today. So today, the focus is going to be to provide you with an understanding and answer as many questions as we can regarding the skilled nursing facility revalidation effort. So as part of that today, we are going to give just a little bit of an overview of the CMS skilled nursing revalidation effort. Most of you are probably very familiar with it, and this is going to be more of a Q&A session, but I want to make sure that we're all level set and that we all understand what we are talking about today. I'm also going to include some provider resources that are going to help you along your way. And again, the focus of today's session is going to be your answering your questions. As we go through the session today, I am going to be using some acronyms, so I'm not going to read these to you, but they are there should you need those as we go throughout today's session. So I'm going to start with an overview, again, of the skilled nursing facility revalidation effort. So the skilled nursing revalidation effort, first and foremost, is an off-cycle revalidation. In previous sessions, we have received questions about the 5-year revalidation cycle and the revalidation lookup tool not having the dates for this particular revalidation effort listed. That is because, again, this is an off-cycle revalidation, and it's happening because CMS has made changes to the reporting requirements for skilled nursing facilities. And they made a change to the CMS 855A end of last year, this last fall of 2004, and there's now the CMS 855A 924 version. And in that version, an attachment specific to skilled nursing facilities was created. So this is an expanded reporting requirement specific to SNFs. It's going to include some information that historically SNFs have always been required to report, such as ownership and managing employee. However, they have added additional disclosable parties, and we will talk about that throughout the session today. In fact, we did receive some questions about filling out that attachment one for those additional disclosable parties. And I just want to be transparent that we are not going through the CMS 855A today or attachment one field by field. However, you will notice that in the chat, you did have a link to two encore presentations. One of those was skilled nursing facilities revalidations, and that one is going to be specific on the revalidation process, some of what we're talking about today, but that's also going to include some more in-depth information about ADPs and filling out that attachment field by field. So if you're interested in that level of detail on that, please feel free to take a look at that. I encourage you to take a look at that. We did also receive a question before I move forward on PACOS and setting up some access. I did also include an encore for that today, just so that you have that. The other thing that I do want to point out is that the additional reporting requirements are something that have been in the Code of Federal Regulations or the CFR for quite some time. They just had not incorporated it into the application itself. So what we're asking for in that attachment is part of the Social Security Act and the Code of Federal Regulations. As we go through today, you will see that I've included some links for that. But again, we're not asking for information that hasn't been there for quite some time. CMS did take some time to add that to the form to make sure that it was meeting the need for the fraud prevention measures that it's intended. So it's just a deeper dive. The other thing that I do want to point out with that before we move forward is that this is going to replace sections 5 and 6 of the CMS 855A for skilled nursing facilities. There is some duplicative information. We'll still ask about ownership and managing control that's currently captured in 5 and 6, but SNFs need to utilize that attachment, and the two sections are not interchangeable. So if you are a SNF, please make sure you're including all of that information in that new attachment. So the revalidation timeline, as I mentioned, they changed the form end of 2024. And so Max started sending out notification letters the end October of 2024, so the end of 2024, and they did it on a staggered cycle, and they did have revalidation dates listed in those letters. And I want to point that out because if you received a letter or when you received your letter, there was a revalidation due date in that letter. That is no longer the official due date, but the new letters were not sent. The due date at this point for responding to those revalidation requests is May 1st of 2025. So that's coming up in a couple of weeks, and those do need to be responded to in order to avoid any potential payment interruptions. Okay, so please make sure that you are responding to those timely and that we do have that postmarked by May 1st of 2025 so that you are seen as having responded to that. The application may not be processed by then. This is about us receiving that revalidation. As that application is processed, if there's development, the provider enrollment area will work with you in requesting that, though that may go past May 1st, but we have to have that application. And I talked about this already a little bit, but the biggest change is going to be those SNF disclosures. It's that attachment 1 that is replacing section 5, and 6 for our SNF providers. So the question we get often is, what are we looking for here? And so, as I said, like all other facilities, SNFs have long been required to provide information about their ownership and managing control. However, this has been expanded. So SNFs now have to disclose all governing body members. That's not all that different from what they've done in the past. We're just going a little bit deeper with those ADPs. This is going to include any officers that you have, any directors that you have, partners, trustees, and again, all managing employees. You're also going to notice when you look at this attachment that for owners, there were there was a 5% threshold, particularly for owners of LLCs. That 5% threshold has been removed. It is now all LLC or limited liability corporation owners. So that 5% interest threshold again has been removed. And then we're also looking for all additional disclosable parties of a SNF. And we're going to talk about the definition of that ADP in a minute, but I want to point out that we're looking for all ADPs, whether they're an individual, whether they're an organization, and then we're also going to be asking questions about the organizational structure and relationship of that ADP to the SNF. So again, this is, as stated before, a fraud prevention measure, and we need to know those that will be involved in making decisions about Medicare funds have access to those Medicare funds, because the best way to prevent fraud is to keep those that would do harm to the Medicare trust fund from accessing those funds in the first place. So defining an ADP, and we do have quite a few pre-submitted questions that came through asking this. You are going to notice that I have combined some of these questions because the answer inherently is going to be the same. So for more information on that ADP, before we get to questions, we do have a link here for the Code of Federal Regulations 424.502. And in that Code of Federal Regulations, you will see that there's a detailed listing of ADPs. Now, one thing what qualifies someone as an additional disclosable party. I do want to state, though, that it's not based on title or type of company. It is about services and type of control and that relationship that they have with the skilled nursing facility. So I did include the link, but I do want to show you that CFR. So this is where that link in your slide deck will take you. It is taking you to the definitions of an ADP. And again, these are the definitions that have been in place for quite some time prior to the creation of this attachment. So they've been here for a long time. CMS just hasn't made it a requirement to report them until they were sure that they had everything set the way it needed to be. So if you have questions about whether or not an organization or an individual needs to be reported as an ADP, this is a great resource for you. So I mentioned the types of services or control. So the things we're looking for is someone who exercises operational, financial, or managerial control. It's very similar to your managing control guidelines today, but we're also looking for those that have some type of ownership, some type of real property ownership. We're also looking for those that are providing accounting services, financial services, cash management services. And this is all defined in, and we're going to make sure that you have a link for this, but this is also defined in guidance that CMS has published. And I'm going to show you where that is. That'll give you a listing of those. So there's a couple of ways to access it. I have provided a link directly to that document, but from the CMS website, to get a listing of those types of services, you can go to Medicare, and you're going under enrollment, providers and suppliers, Medicare enrollment for providers and suppliers. And then here in the news and additional resources section, and you're going to see that it is highlighted in green, you have two links specific to SNFs. Now, the link that's There's two links. One is going to be the workflow inside PAYCO. So if you have questions regarding that, that is a fantastic resource for you. But also you're going to see CMS's guidance for completing the SNF attachment on the CMS 855A. And what you will find in here is a listing of the definition of an additional disclosable party. And again, we just discussed some of those, but you do have that. This is also going to have some frequently asked questions. If there's something additional that we don't cover today, I encourage you to take a look at that resource as well. Next, we are getting a lot of questions about non-response. As I said, the deadline for responding to these is going to be May 1st of 2025, and non-response looks like that you've not responded to the initial solicitation letter. You are seeing the 90 days here. That's been extended because of that May 1st, so it is May 1st. If you do receive a development request, you will be given a 30 days to respond to that. And those 30 days do need to be adhered to. So you will need to make sure that you are responding to anything in a development request within those 30 days. If you fail to respond, this is where you may see an interruption in payment in the form of a stay of enrollment to begin with, and potentially the deactivation of your billing privileges. And this will impact the entire enrollment, and we want to avoid that as much as possible. So we're going to move into the question and answer session here. Again, this was intended to be a brief overview, and what we're hoping to accomplish here for you today is to get your questions answered, your questions answered so that we can get your revalidations in-house and processed so we can avoid any payment interruptions. And here, as I mentioned, I am just including some additional resources that are available to you to help you with this. We do have a couple of new resources that are going to be available. What you have here is some detailed information about the disclosure, links to the application itself, and some resources about the off-cycle revalidation. But what I do want to point out is a new resource that just published last week, and it is under the Provider Enrollment Topic Center, and you are being provided with a link to that today. You can also search by the word matrix and you'll be able to pull this up. But what we've created is a provider enrollment matrix for the attachment. And if you go to the provider enrollment resource page, you're going to come to the revalidation accordion, and here is that matrix. And what this is, it is a chart that goes field by field through both the organization and the individual sections of that attachment, and it's going to give you the field name and then tell you if the field is required, meaning you must complete that. There are going to be some instances here, for instance, an organization may not have a doing business as name. That's not a required field. If you have that, please provide it, but it's telling you whether or not it's going to be required when that comes in for review. So I encourage you to take a look at this. You'll also notice that we're calling out where you must answer a question, yes or no. You must respond. And then if you have to answer questions because of how you answered a previous question. So this is meant to be a visual guide to you through that attachment to help you finish up those applications and get those sent in. So that brings us to our focus for the rest of the day, which is going to be your pre-submitted questions and answers. As I mentioned earlier, we received quite a few pre-submitted questions and answers after the material was posted. So they won't necessarily be, or they're not going to be in the presentation material, but they are going to be in the recording. And any questions that we do not get to today will be part of a follow-up document that we will send out to all attendees today. The other thing that you're going to notice is that I'm going to be combining some questions, so you may not hear exactly the verbiage that you sent in your pre-submitted question, but I am responding to multiple questions, and Adrian and I are both responding to multiple questions at the same time because they were either identical questions or very similar questions. So we did that to allow for as much time as possible for questions today. So our first question that we got was asking if we can name specific types of vendors that need to be reported as ADPs. And as I stated earlier, CMS is not identifying ADPs based off of vendor types or even titles of individuals. So they've not issued specific guidance listing that, but we're looking for whether or not they meet that definition of an ADP. Are they providing consulting, clinical consulting services, cash management services? Do they have a real property interest? So you'll want to make sure that you're referring to that CMS guidance uh, about ADPs and ask yourself if that entity or that individual meet those criteria. And if they do, they'll need to be reported. The next question is asking about a clearinghouse. And this is similar, and this is one of the questions that you'll notice that we're definitely combining as we go, but it depends on whether or not they are providing services as outlined by CMS. And if they are, they would need to be reported. So I know we were just there, but again, that is the importance of taking a look at this guidance and looking to see if they fall into any of the outlined categories. Are they providing those services? Do they have, do they lease or sublease real property to the SNF? So if the answer is no, they would not need to be reported. But if the answer is yes, to any of those, they need to be reported. Next question was that our firm provides accounting services to the SNF. However, we do not have any ownership of or control over the SNF. Must we still be reported as an ADP? Now, this is a scenario that we can speak to specifically. They indicated that they're providing accounting services to the SNF, and that's really the key here. So because they are providing those accounting services, they do need to be reported so long as they're falling within one of those categories that we just spoke about. And in this case, because they're identifying that accounting service, that firm would need to be reported as an ADP because they are providing that accounting, that financial, and likely that cash management service. So next they're asking how you access attachment 1 for skilled nursing facility disclosures in PACOS. And again, this is a fantastic question. So what they did with the reporting for that ADP disclosure, they did not create a separate section inside of PACOS. What they did is they added the questions to the existing ownership and managing control topics inside of PACOS. And that is also one of the resources that we just showed you, but I want to make sure that you're aware of where it is. So on the provider enrollment page for CMS, there's a second resource, and this is going to be the PACOS workflow. And so it's going to show you how this is going to work as you go through PACOS, complete with screenshots and explanations of how to complete the fields. It's going to line up with the application, maybe not exactly, but it's going to ask the same questions. They may be in, you're going to see questions that are going to activate based on how you answer other questions. So when I say it's not going to look exactly like it, it's not necessarily going to list all the questions in one list. It will activate questions or additional fields as needed. And that can actually be helpful as you're going through PACOS filling this out as well. PACOS will know based off of how you answer the questions what you should see next. One caveat with this as well, if your provider type on the enrollment or the application that you're submitting is not a skilled nursing facility, you are not going to see, excuse me, you are not going to be able to see those fields. That is something that is specific and will populate based on the provider type being a skilled nursing facility. Next question is asking about the 5/1 deadline and if that's received or postmarked. And as I mentioned, that is going to be postmarked by 5/1. So it's not that we have to have the application have it processed by 5/1, but we as a MAC have to have that postmarked to us by 5/1, and we will continue processing, and your enrollment will remain open, provided that we have that application by 5/1. We'll process it from there, which will either be an approval, or if there's development, you will receive a notice of development with a list of the information that you need. But you will need to respond to that within the time frame designated on that development letter in order to ensure that your enrollment will remain open. So this brings us to our live questions and answers. As I stated, we did receive quite a few questions after the training material was posted. So I'm going to start with those pre-submitted questions, and we received a lot of great questions. So again, I want to thank you all for submitting those to us today. They really do help us make sure that we're meeting the mark for all of you. So Adrian's going to be helping me as we go through these. I'll start with the first question. So for organizational ADPs without qualifying owners to be indicated as individual ADPs, should that be addressed somehow? They're indicating that they're all partners of a limited partnership. They're less than 10%, and we are entering the organization with no associated individual. So in this instance, no, per the CMS guidance, in their limited partnership, they'll only list the persons with 10% or more interest. And I know I talked about that 5% threshold, but keep in mind that's for LLCs with ownership, and this is a partnership with no ownership. So because they're less than 10%, these would not need to be reported. However, if these individuals meet the definition of an ADP based on any services they provide. So again, I'm going to that CMS guidance and cash management services. Are they creating policies? Do they have, are they leasing or subleasing real property to the SNF? They may not need to be reported as a part of that trust or that partnership, but they may provide a service that requires the individuals to be reported. So with that, Adrian, I'll hand it to you.
All right, our next question is, when and how do we receive a notice for skilled nursing facility revalidation? And we did cover this in the presentation as well, but just to reiterate, those revalidation requests were still to all of our active skilled nursing facilities with active enrollment records as of October 2024 through December 2024. We had 3 different cycles, and they had 3 different revalidation dates. However, no matter what revalidation date is on the letter itself, the due date for all of them is May 1st, but there were 3 different cycles for those revalidation requests. And if you have not received your revalidation request, or your revalidation letter, I should say, you would need to contact our customer service area for the status of that. And there are providers that were exempt from revalidation if we had an application in-house at the time that this came to us from CMS. That would have been October 1st of 2024. So if you have not received a request at all to complete the SNF attachment, I would ask if it's time you submit a change of information request to update your enrollment record, because CMS will be looking to have that information updated on your enrollment record.
All right, thank you for that, Adrian. And everybody, if you do have questions, including status, I have included the call-in information for our customer service area so that you have that. So our next question is asking about the types of entities required to be reported on the application. And I'm taking this question to mean everything, including ADPs. So what we're looking for, as we stated in the presentation, any owners. Now this is going to be direct or indirect owners. We are looking for managing control or managing employees. And then we're also looking for those ADPs as they're defined by CMS. All right, Adrian, if you want to take the next one, please.
All right, our next question is related to question 3, which is how to check the status of your revalidation. Again, you can contact our customer service area, and we also have a tool on our website called the EASI tool, which is Enrollment Application Status Inquiry. I can place a link to that in chat. And you will need to have your PACOS tracking ID or the application ID itself to to look that up with that tool. If you have looked on the website and you see that we've received your revalidation, but you haven't gotten your letter yet, we would need to have some additional information in order to look at that status for you, but we're more than happy to do so.
All right, thank you. So our next question is asking where we can find the online app with all of the questions listed so I can gather my information at once instead of having to click on the question and see what is required. Fantastic question. Ties into what we were talking about with the workflow as well. So for that, if you're looking for that, I do have a link. The online application is available on the CMS website, and I'm putting this link in chat to take you directly there. But this is the paper application. Now, I'm always going to advocate for you to submit your applications electronically. It's going to help you by asking the questions in the appropriate order to fill out the information. And it's also something that allows us to be more efficient in the processing because there's some automations that we can take advantage of. And it gets to us quicker. Paper applications need to be ingested. However, I absolutely appreciate the question being, I need to know what all I need to have before I start filling out the application. So this application, it's somewhere around let's see if I get to the right page, almost. So if you start on page, pardon my scrolling, y'all. If you start on page 52, you'll see the instructions portion start. These instructions, if you haven't already taken a look at them, they're actually quite good and they're a nice supplement to CMS's guidance as well. Includes some definitions, a lot of similar information in it, but it is here for you as well. But that's where that starts. And then the sections themselves start at page 55 of that paper application and go right down the line. So if you're looking to determine what type of information you have to have, this is a good place to start. And this would be that list of those sections that are needed. All right, Adrian, off to you.
All right, next question is it necessary to list all nursing supervisors? The answer for that is that they should be reported if they meet the definition of a managing employee. So a managing employee is an individual including a general manager, business manager, administrator, director, or consultant who directly or indirectly manages, advises, or supervises any element of the practices, finances, or operations of the facility. So per CMS's guidance document, this does not mean every employee who is responsible for any action in the SNF's organization, such as a nurse or admin assistant. By nurse, I mean those who interact directly with the Medicare beneficiaries themselves. So there has to be some degree of broader oversight and decision-making authority involved. So if your nurse and supervisors are providing any kind of guidance as far as like the elements of the practice itself, providing any kind of guidance for how the staff approaches certain things, procedural, operational, what have you, and they have that authority and oversight, then they would need to be reported on the application. All right, Leanne?
Okay, thank you. The next question that we received is a little bit more overarching of the 855A or even the 855B, but it's very applicable here with our revalidations. And the question is how to add or remove an authorized official. And with the 855A, it's a little bit different. There's, if you've filled out the 855B, you'll know that that's one of the roles. On the A, it's not going to be one of those. What you're going to do is utilize section 15 to add or remove any authorized officials. And by authorized officials here, we're talking about those that can sign on behalf of the organization for the application. Now, if you're talking about authorized officials inside of the identity and access system, that is going to be something different, and that does need to be taken care of inside of that identity and access system. And I did reference that YouTube, and that was a link to that was placed in the chat. That YouTube does walk through how to do that, so I'd encourage you to take a look at that. All right, Adrian, go ahead.
All right, next question is, do you need to fill out a revalidation for every entity under one tax ID? And so if you have received your revalidation notice, you will notice that they are listed there by legal business name, by the MPI, but the most important information you have on there is going to be the PTAN. And this is important because revalidation is done by the enrollment record. So you'll know how many enrollment records that EIN will have based on how many PTANs have been issued for that provider. And that's how we tell which enrollment is associated. And again?
Thank you. So the next question was asking, and I'm asking as it was written, so I'm just going to explain some or clear something up here. We received the question as is D or LD considered an ADP. We are interpreting that as a registered or licensed dietitian. So they should be reported if they meet the definition of a managing employee. So a managing employee is an individual that includes a general manager, could be a business manager, administrator, director, or consultant who directly or indirectly manages, advises, or supervises any element of the SNF. So this could include their finances, they could be creating policies, they could have overarching oversight over that SNF. So again, I will direct you back to the CFR and the CMS guidance document that'll lay out whether or not they need to be reported. Are they providing those services? Do they have that type of managing control? Again, it's hard to say that a registered dietitian or a licensed dietitian needs to be reported because it's not based on the fact that they are that dietitian in the facility. It's based off of what services they're providing for that SNF. All right, Adrian, go ahead.
All right, question is, may the revalidation and disclosures be completed via PACOS regardless of the number of ADPs that need to be submitted? And the answer for that is yes. PACOS does not have a limit for ADPs when completing the CMS 855A application. And just remember, those ADPs have very some of them have a pretty broad definition, some have a very narrow definition. So if you know that they're an ADP, they should be reported because of what they provide for the skilled nursing facility itself. Then they should go ahead and be reported on your application. And PACOS does not have a limit on how many of them you can report. All right, Leanne.
I would just add to what Adrian was saying too, is again, this is me advocating for PACOS, is that it's just a little bit cleaner as well, because if you're doing this on the paper application, we are aware these are not going to be small sections for you. You would have to make multiple pages of that paper application, whereas PACOS, it's as simple as once you've completed for one, you can add another one and continue forward. So if that makes it simpler for you, I do highly recommend that. So moving on to the next question, the question was, what of the off-cycle process, or what does the off-cycle process look like in compared to a traditional revalidation? So they're both completed in the same manner. They're very much the same thing. You're essentially filling out the entire application to revalidate, recertify, reconfirm all of the information that we currently have on file for you. So you do have to fill it out, even though something's already on file. We need you to fill out the application confirming, yes, this is still the case. This is also an opportunity, if you've not yet reported changes, you can make those changes. That includes any additions or deletions on this revalidation. So a lot of this is very much the same. This particular off-cycle revalidation, though, because of the new form, because of the new attachment, that attachment's really the biggest change. However, moving forward, that attachment's going to be required for new SNFs. It's going to be required for SNF revalidations moving forward. So as far as that process, it's the same as a regular revalidation. It's the timing of it. Adding one more thing to this, sorry, Adrian, but we've seen questions about how this impacts the 5-year cycle for revalidations, and the response is it doesn't. As I said earlier, the lookup tool hasn't been updated. The revalidation dates that you see inside the PACO system haven't been changed, and that is because this is again off cycle. So it is possible you could be asked to do your 5-year cycle revalidation sooner than 5 years. So this should not be calculated into that 5-year cycle. All right, Adrian, go ahead.
All right, what filing method does WPS recommend for a standalone facility or provider, manual or online PACOS? And for that, I would definitely, echo what Leanne has stated. PACOS is always going to be the simplest and most efficient way to submit an enrollment application to the MAC, and that is because you do not have to be, copying the exact same page, what used to be section 5 and 6, the same pages over and over. Depending on how large a facility is, it could get to be quite a large application, and it's honestly easier for the provider and for analysts to see all the information on one page rather than hundreds and hundreds of them. But again, just depending on the amount of information that you have to submit, I would definitely say PACOS is going to be easier for most providers. All right, Leanne?
Thank you. We received a question that asking about whether or not a request for an extension can be provided. So at this time, we have not received any communication from CMS indicating that extensions are being granted or allowed to be asked for at this time. So what we are seeing though, and this kind of relates, this does relate to a question that we have coming up, is if you've not been able to obtain all of the information about an individual or an ADP organization that needs to be reported on the application, their social security number, tax ID, date of birth. That's a little bit different than asking for an extension. We'll talk about that, but really that's documentation showing us what efforts have been put in place to get that. That can be submitted, but that is not to be confused with an extension. I presume that the question is asking an extension is being wanting to be requested to extend the deadline past 5/1 of 2025. And I just want to point out that that 5/1 2025 is already an extension. Providers were being given 90 days at the beginning of this. So that May 1st is already an extension, and CMS has not provided any information that they are granting further extensions. All right, Adrian, go ahead.
All right, the question is, we use an accounting firm to perform our cost report. Please specify to what degree ADPs need to disclose along with proper org chart information needed. So again, we need to know exactly what kind of relationship that ADP has with the skilled nursing facility itself. So if they have operational, financial, or managerial control, or they provide policies or procedures, or if they provide financial or cash management services, or they have any relationship to leasing of the real property that the SNF owns, or own the real property that the SNF leases itself, or if they provide any kind of administrative services, clinical and consulting services, or accounting or financial services to the skilled nursing facility. So the accounting firm, if they are providing accounting or financial services, they are by definition an ADP, and they should be reported, as well as the individuals who are actually, contracted to have that relationship with the skilled nursing facility itself. As far as to what degree the ADPs need to be disclosed, we get this question a lot as far as social security numbers and date of births. The social securities and date of births are only needed for those 5% or greater direct owners of a skilled nursing facility itself. So that would not be an accountant, or if they're a partner in the SNF itself, if they're a managing employee, or if they're a corporate officer or director at the skilled nursing facility itself, or if they themselves own 5% or more mortgage or security interest in the skilled nursing facility itself. So if they're an accountant who has that relationship to the skilled nursing facility and all that they do is provide services to the skilled nursing facility, they would not fall along that disclosure, and they would not need to report their social security number or date of birth. All right, Leanne?
Okay, next question is asking when the trustee or trust in that trust company, do they need to disclose the ownership of the trust company, or just disclose the trust company itself? The trust company is not an ADP of the SNF. It is simply the trustee of a trust with indirect ownership in the SNF. The response to this is that all trustees, they have an indirect ownership in the SNF, so all trustees must be disclosed whether they're an ADP or not. So the answer is simply they do need to be disclosed on that application. Adrian?
All right, next question is another one that we receive a lot, which is how do the organization charts need to be set up in regard to direct and indirect for sections 5 and 6? Am I able to share my screen?
You should be able to, Adrian.
All right, let me try this.
And what I'll do is I'll stop sharing mine. And now you should be able to share at the bottom of your screen.
All right, can y'all see that?
We can.
All right, so at minimum, every skilled nursing facility should have at least 2 org charts. Technically, it's 3, but charts 1 and 2 can be combined. So for the first organizational chart, you will have your skilled nursing facility itself, and then all of those orgs that have a managing control or ownership of the skilled nursing facility, so not necessarily an ADP, but they still are listed on the what used to be section 5 of the application. They will be on this org chart. And then any ADPs that are listed on the application itself and what used to be section 5 will be on this org chart. As for individuals, we're only concerned with those owners who have an ownership interest in the skilled nursing facility. So that would be the 5% and greater indirect ownership, 5% and greater direct ownership. And those that have 5% or indirect or direct ownership for a non-LLC. So if you're a corporation who has individual owners who have less than 5%, they will be on your org chart, but not on the application. The only exception to this is for those LLCs who need to be reported regardless of the percentage threshold. They will be on both the org chart and also the application itself. But for all non-LLCs, those that have less than 5% ownership, will be on the chart, but not the application. That's chart 1 and 2. This will hopefully be published on our website as well as a guidance document. And if the last chart is the charts for the ADP itself and their relationship to the skilled nursing facility. So again, this is going to have your skilled nursing facility. This is section 2B1 for the SNF. And all the ADP orgs just as they were listed on the previous chart, and then all those persons who have an indirect or direct ownership interest of the ADP, regardless of the percentage. And so these are different roles here. 5% and greater direct or indirect ownership of any ADP of a SNF, meaning for those corporations, and then direct or indirect ownership interest of ADP of a SNF, regardless of the percentage for those LLCs. So on your application, depending on how you're reporting it, all owners of ADPs will need to be on the STIR chart as well. And this is also on the application as well. And it's also on the CMS's regulatory guidance document as well.
All right, thank you, Adrian. I appreciate that. I'm going to go ahead and reshare my screen. And everybody should be able to see my screen again with the questions slide. So we have time for a few more questions. As I stated at the beginning, you all, we may, I don't think we're going to get through absolutely every question that we have. However, we will get you answers to those questions. We're going to take as many as we have time for yet today. I will be sending up a follow-up document, including pre-submitted, and I've seen some great questions come into the chat. I'm going to make sure that we get answers set up to those questions sent out as well in that follow-up document, and I'll send it to all attendees for the session today. So if we aren't able to get to your question today, again, don't worry, we are going to get you responses to those. So moving right along, the next question is about owner effective dates. So an example was provided that we take over operations of a facility on 3/1 of 15. One of the indirect owners is an LLC. The ownership percentages of the indirect owner fluctuate, but for owners, they are the same. What effective date do we use? The question is asking if the date that the person or entity obtained their interest in the indirect owner, or is it the date we took over operations of the facility, which is that 3/1 date, or is it the effective date for that person's entity, that person's or that entity's current ownership interest in that indirect owner, because things have changed just a little bit. So what you're going to want to list is whenever the relationship to the SNF was first established. So we can certainly get changes of information, and we do get them all the time that have minor changes to the ownership percentages, but for the effective dates, The effective date of that ownership doesn't change. The percentage might. It doesn't change the effective date. So of the relationship itself, it changes the effective date of that percentage. So unless the role is new or newly being added or removed, you're going to use the date that they originally had that ownership interest in that SNF. All right, Adrian, on to you.
All right, the question was what employees are required to provide info for during the revalidation? And the examples were given were NHA and DNS. I'm not entirely sure what those acronyms mean, but as far as the skilled nursing facility itself, all they were looking for are the owners and managing employees of a skilled nursing facility. The managing employee definition was provided earlier in this Q&A. And those ADPs who have an ownership in those ADPs, so not necessarily all the employees. We're mostly interested in those who furnish services directly to the skilled nursing facility itself, and those who have an ownership in the ADP organizations that are reporting on the application. All right,
All
Leanne?
right, thank you. Next question is asking about who we can contact for help with access to completing the revalidation. And I'm going to put our customer service area information back in the chat for you so you have it. They're going to be able to answer those questions and help you with that process. Again, there is also that YouTube available that goes through how to complete that attachment and that revalidation, and then that matrix that we talked about earlier. And we have those links for you in the chat. And I'll include those links in the follow-up that I will be sending as well, so that you have that. All right, Adrian, go ahead.
Okay, the question is what amount of detail is CMS looking for? This is a fairly broad question, but I'm trying to narrow this down. So CMS is looking for the information pertaining to all governing bodies of a skilled nursing facility. So that includes entities with direct and indirect ownership, managing control, and ADPs as defined in the CMS guidance for the SNF attachment on the CMS 588 form, but also those ADPs. So as far as like the granular detail, again, we're mostly looking for the relationship to the skilled nursing facility itself. So if that organization or individual provides policies or services, any sort of like advisory role as far as like the policies and procedures of a skilled nursing facility has any kind of control of any part of the skilled nursing facility itself or any ownership of the skilled nursing facility itself. That is the amount of detail that we're looking for. All right, Liam?
Great, thank you. The next question is asking about is if the normal revalidation fee is required for off-cycle revalidations, and will it be about 5 years from the off-cycle revalidation until the next revalidation is due? And we talked about this a little bit. It will not necessarily be 5 years before the next SNF revalidation is due. And that is because, again, this is an off-cycle revalidation because of the changes in reporting requirements. So you will be contacted when your next revalidation due date is for the normal 5-year cycle. And I'd encourage you to continue to look in PACOS and that revalidation lookup tool. The other piece about the fee, this is a revalidation. It is off cycle, but it has the normal requirements. Off cycle and regular revalidation, their process is the same. And that includes the payment of that fee if it's required for the facility. All right, Adrian.
All right, the question was regarding the real property, and the question was stated, what are you looking for with the total value of the real property? We're at one location with independent living, assisted living, and a rehab center. As far as the total value, the total value of real property is not disclosed nor needed to reach a certain threshold for total. We're just looking for those percentages that are greater than 5%. So if you have those three facilities and they're separately represented by an organization that directly or indirectly own the SNF's real property, each of those would have an equal share. It was roughly 33% of a total value apiece. So that would be an example. If those are, so again, so we're not looking for like the total value itself, just for the percentage of it. But then the organization reporting on the attachment would then be reported in question 13 as a 33% real property owner. So it's not by what is on the property itself, but those organizations that own the real property and how many of them there are. All right, Liam?
All right, thank you. We are coming up on time. I am going to answer one question before we wrap up, so if everybody can hang out with me for a second. So this last question was asking about how we were supposed to obtain officers and directors of the ADP, and they were looking for getting the information on those individuals. We get those questions a lot, so I want to make sure that we are addressing that here. So CMS does expect providers to make all feasible efforts to secure the required information. So in the document that was sent out, the CMS guidance, in the FAQs, there is actually a section that's talking about, right above the FAQs, I'm sorry, there is a section that talks about efforts. So they do expect you to make multiple attempts to try and get that information. If it looks like it's not feasible, you're not going to get that information, you can provide documentation that shows how many attempts were made, what attempts were made, how did you attempt it, writing, call, what have you, what information is not available, and that can be sent in with the application. Now, it doesn't automatically guarantee that that's going to suffice for the information that we need, but what it does is it allows the provider enrollment analyst and provider enrollment in general to communicate with CMS to determine next steps, but you are expected to make that good faith effort. So with that, as I said, we are at time, so I'm going to go ahead and wrap up. Again, any questions that we didn't get to today, we will be getting you a response in a follow-up document, and I will be sending that to all attendees. And as I said, I will be including our links from today as well. So if in a few minutes, as you sign off the session, you are going to get an email that's going to thank you for attending our session today. So if you're attending for continuing education credits, don't delete this without taking a look at it. This is actually your certificate of achievement for attending today. So you're going to see the bottom red rectangle there. It's going to have the date and it's going to have the time. This can be submitted to your certification or accreditation body for continuing education credits. You can submit that to them and they'll credit those towards those. If you didn't get it, one of two things happened. Either it went to your junk or your spam. It comes from our webinar software and it's going to say WebEx. That is a safe sender. So if you want to add that to your safe sender list, it won't go to your junk or your spam in the future. The other thing is that if you attended by phone today, our system simply can't identify you to give you this certificate. In either situation, you are not out of luck. I am going to have Ashley put our WPS education email in the chat again before we leave today, and you are going to submit an email with the subject being the title of today's session, which is the SNF Revalidation question and answers. That's going to let those that monitor that mailbox know they need to get that to Leanne so that I can go ahead and get you a physical certificate out to you via email. Follow-up questions, as I said, I'm going to be sending out any questions we didn't get to today, but I will continue to take follow-up questions for the next 7 days. Just send an email to that WPS GHA education mailbox with today's subject. And again, that'll get directed to me and I'll get a response out to you. And we'll send that out also to all attendees so that you have that information. So as I mentioned at the beginning of the session, we are going to give you an opportunity to provide some feedback. I look at all of that feedback and we take that to heart as far as directing where our educational goes in the future. So tell us what you like, tell us what you didn't like, tell us what we could have done better. And also, this is an opportunity for you to provide feedback on education that you'd like to see in the future. As I said, your feedback drives our education. So please send us everything that you have. We really do want to hear from you. We will take a look at that. Sorry, clicked too quickly. Couple of ways that you can take that. One, you did just get a link in the chat and you can click on that. It'll take you right into that Qualtrics survey. The other thing is you are going to get a redirect when you leave this session. It's not spam. It's not malicious. It's not taking you anywhere you don't want to go. It's just telling you you're leaving our webinar software and going into our survey software. So you can take that survey any way you choose, whichever is most convenient for you. And again, I truly do appreciate your time taking that. With that, that does end our session for today. On behalf of myself, Ashley, Adrian, and the entire WPS Provider Outreach and Education team, I'd like to thank you again for taking the time to join me today. I know I went a little bit over and I do appreciate you sticking there with me. We do look forward to those survey comments. So again, please be sure to include those topics you'd like to see in the future. But again, have a great day. Thank you for attending. You may now disconnect.